Hi. Hi, I'm Viv and I'm the face behind Skinpharma Aesthetics in Stockton-on-Tees. And tonight I think it's the 12th in a series of lives I'm doing, hi Tom, I'm doing with Sunny, who's a doctor and aesthetics practitioner like myself. And it's to look at our journey in the use of ultrasound in our aesthetics work. Sunny, unfortunately, is on holiday this week and next week, but he'll be back the week after. So this week, I will just add the guest on. I'm speaking to a fantastic practitioner called Tom Decates. I'll let him tell you about himself, actually, once he joins up. It should be a second or so, shouldn't be too long. Hi, Tom.
Viv, there we are.
How are you doing?
Amazing, my friend.
It's good to see you. We've never met before, but it's nice to speak virtually anyway.
Yeah, it is. But unfortunately, we have not met yet.
Not yet, true. I was over in Amsterdam last month doing some training with Tom Van Eyck.
And you didn't call me.
I didn't know. I should have checked. It was my fault. Apologies for that.
No worries,
Leone
no worries.
ended up with COVID coming back from IMCAS. You, I think, hopefully were fine returning from Paris.
Yeah. I decided this time not to kiss with Leonie, so I didn't have COVID.
I'm sure she's going to be laughing right now in Amsterdam with you saying that. But it's really kind of you to join me tonight. As I've really kind of you. You do some fantastic work, and a lot of people don't realise the importance of your research. And I've been reading it these last few weeks, and I've been thinking to myself, you know what? You should be on news programs all over the world talking about the importance of your work in cosmetic treatments for patients all around the world, not just in the Netherlands. But your work is relevant to the practice that's carried out all over the world with dermal fillers. So Sunny, unfortunately, as I was just mentioning, he's on holiday over in Asia somewhere. So it's just
his loss.
His loss. He's back in a couple of weeks, but I thought it'd be nice for us to talk about your work and the relevance of your work to aesthetics and ultrasound in particular. So I thought we'll go through the different things you do, Tom, and I've got some examples of scans that I can use in a little while that can be used to demonstrate the importance of your work, your research work in particular. So to begin with, how would you describe the different types of work you do, Tom, in aesthetics, from your research, your practice, your training? How would you describe it for viewers?
Yeah, poof. We have at about 30 minutes or something. No, my friend, so in the last couple of sentences, you said a lot of things. First of all, thank you very much for all your compliments. But the reason why I'm not speaking yet on global television is what I'm saying, like with my team as whistleblowers, isn't that kind to hear for pharmaceutical companies, for injectors. So I don't have that many friends, but I don't care. I think we are on this world to help other people. And I have the strength, the energy, and the love to do good.
Yeah.
And I know that at first, everybody became an injector to do good. But somewhere around the way, some people get lost in the heaps and heaps of money they can make. So, that's the reason why I'm not always loved by everybody. But when I was, for instance, in the US a couple of years ago, after my lecture, somebody came up to me and he said, Dr. Decates, I advise you not to rent a car and go for a ride.
Right.
Let it sink in.
Ah, okay.
Yeah. So we're trying to do good for society, and then
Yeah.
this happens, but it's quite easy. So we saw a lot of adverse events, like every doctor sees adverse events, but in our case at the University Hospital in Rotterdam, together with Leonie Schelke and with Peter Veldhuis, and we saw those adverse events, and we thought, quite interesting. Why do adverse events happen?
Yeah.
So Leonie, I call her the queen of ultrasound, and she did the invention, and she trained me to use ultrasound that as when an adverse event has happened, to be more capable and easier dissolve the adverse event. But I, together with also Leonie and Peter, also wanted to go a layer deeper. What happens when a soft tissue filler is injected inside the body? What happens inside the body? And then if an adverse event occurs, what is the reason? And we had three thoughts, three hypotheses. One of them was that there could be a genetic predisposition.
Yeah.
Second, we thought that maybe bacteria are injected during the initial treatment. And three, that possibly your immune system goes berserk for some reason we don't know yet.
Yeah.
And we dived into those three subjects, and that is where my thesis is mainly about. And I have very good news for you and all our viewers and listeners. We only just begun. So we did a very small top layer, but now I'm diving into the deep. And the reason why I'm having all these live Instagram meetings and blah, de fucking blah, I want people all around the world to also be enthusiastic about science.
Yeah.
And since we as injectors make so fucking much money, we have a lot of time to also to do good and to dive into aesthetics of science. So please challenge us. So in a few weeks from now, our newest article in Plastic and Reconstructive Surgery will be published, an original article. I'm very, 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 very proud of it. And it's all about bacteria, because we think that bacteria also have something to do with getting adverse events. But if you read it, and you think Tom and his team is talking BS, then also do science. And yes, I'm not getting paid for it. And yes, I do my science in my own time because I want to know and I want to do good. But please also do science and just not inject all the time and make money.
You're going to be getting on the nerves of a lot of drug companies around the world, Tom. Yeah, I agree with you. I'm a pharmacist. I'm a clinical pharmacist. And I know what goes on with drug companies and production of medication. People think, is the production of medicines a benefit to the patient or is it a benefit to the drug company? Who's to know? Who's to know? But with fillers in particular, it started off as a medical issue, treating patients by dermatologists, by doctors. And in the UK in particular, everyone's gone crazy. Everyone's injecting everyone else in the UK. In the Netherlands, you've got medical processes that you follow, referrals from practitioners to check on patients that might have filler complications. I was talking to Leonie last week about the fact that she only sees patients that are referred to her from other practitioners. She doesn't see patients self-referring themselves. But along the way, some craziness has gone on. And as you've mentioned, a lot of it is down to money, unfortunately. But how did your work begin, Tom? How did you actually start off with your interest in dermal fillers? And how did you meet up with Leonie and Peter?
So, again, I think we are on this earth to help other people. And I'm a very naive and romantic person. So I think that I want to do good. And I was in the lucky position that at about 10 years ago, I started to work with Leonie and Peter, and they taught me how to use ultrasound, but they also give me the enthusiasm to know and to do research. And Leonie taught me more of the practical part of doing science and using ultrasound. And Peter Veldhuis, he really was my mentor in that specific science and diving into, okay, Tom, what you're saying is very bold, but please come up with some scientific background. And then Leonie and Peter and we went to dive into science, and we were very, very sad to see that there wasn't that much science. And at every congress all around the world, doctors with very big shoe sizes, they say all kinds of things about how good they are and what they have seen in their own practice, but it has nothing to do with science. So then we thought, come on, let's dive into this. For we see in our outpatient clinic at the University Hospital in Rotterdam at about 500 adverse events a year. So in our humble opinion, we are the biggest outpatient clinic in the world. And all those patients, with all the respect for the patients, they bring a lot of knowledge. So we start taking biopsies, and we started to do all kinds of immunohistamine coloring, and we dive into specific bacteria, and we did the mucosa swabs to dive into DNA. And in this way, we did a lot of inventions, and we've done a lot of research, but still it's just a basic layer that we touched. Please, everybody from all around the world, help cosmetic medicine to dive into it much deeper.
Sorry, Tom, do you speak to other researchers around the world that do similar work to you? Is there many of these practitioners around?
Not that much, and there are some very good researchers all around the world, and since how do I put it, I have a very big mouth, then people, they hear about me and they contact me and they say, Tom, what the FUCK are you saying and what are you doing? And then we talk, and then they notice that I have a good heart and I just want to do good, and then they want to collaborate, and it's like an oil stain, so it's getting bigger and bigger and bigger and bigger, and so we're spreading the love and the knowledge all around the world. There are some scientists which are working for those specific filler companies, so they of course are very biased, but all of them that I've met there are good people who just work for a pharmaceutical company. And again, I use dermal fillers all day long, so I also do 3,000 treatments each year. And I'm happy, and I can give beautiful results, and everybody does it in his or her way. So
you're an all-round cosmetic doctor. You don't just practice, you research and you practice what you preach. So you don't just start writing and let other people follow your advice. You actually follow your own advice, and you improve your practice as a result of what you learn. It's just I think a shame that there isn't more people like you who are determined to find an answer irrespective of all the pressures around them.
Now, thank you for your kind words, Viv. But like, for instance, take Tom van Eyck. Tom van Eyck, he is the one who has patented the Fern pattern in injecting. So that's his baby. And with training everybody in the world to do that specific treatment, he also, in his way, made cosmetic medicine more safe. So there are a lot of good people in our practice, in our line of field, who just want to do good and do that in their way.
It's strange that the three practitioners I've now spoken to, either face-to-face or via social media, they're all Dutch. You, Leonie, and Tom van Eyck, all of you. What is it about the Netherlands? Is it the water?
No, fifth, if you ain't Dutch, you ain't much.
Fair enough. That's
No, but like, how do I again put it? Yeah, there are of course people that don't like it, but we are very bold in our statements, and we're
yeah,
very out there. But again, and we didn't even mention, for instance, Jani van Lochem, also a friend of mine, also a scientist, also got his PhD in solving the adverse events of soft tissue filler treatments. We've got Jonathan Kadouche, also got his PhD in solving the adverse events complications. So
yeah,
again, we have so much people in Holland who just want to do who want to do good and dive into it.
yeah.
Maybe there are a lot of doctors all around the world who are also interested, but are not as bold as us in their statements. So that could also
Yeah.
be a reason. Yeah.
Well, it's good that you can speak openly about what you think about the whole area of adverse events and fillers in particular. It's not just research. You do lots of research at Erasmus at Rotterdam, but you also carry out training as well. Do you do training work as well, Tom?
Yeah, everybody from all around the world is always welcome to come to me in Rotterdam at the Erasmus University and see how I solve soft tissue filler adverse events. So next week, somebody from Germany is going to watch over my shoulder. And last week, somebody from Brazil was there. So everybody from all around the world is welcome. If you're looking into that specific training of ultrasound, then Leonie and Peter are the people you should go to, because we talk a lot about science, we talk a lot about aesthetic medicine, but if I introduce myself anywhere in the world or in a television program or somewhere else, at first I'm a husband and a father. So
Yeah,
my wife and my children are the most important people for me. And next to that, I like to be a scientist. I like to
yeah,
be a doctor, but I'm also an healthcare entrepreneur, because out of our scientific research of the genetic predisposition, we did the invention of a DNA test that can predict if you're going to have a soft tissue filler adverse event. And
yeah,
it's not that black and white, but it can help you to make a choice before
yeah,
treating a patient. We're going to collaborate with Wigmore, a big player in
yeah,
you know them? Yeah,
yeah.
we just had several meetings, and in the November of this year, the 18th, 19th, and 20, yeah, of November, I again will be in London, and I will
Yeah.
be talking at the CMAC Congress. Do you happen to know it?
Yes, I'm a member of CMAC, Complications
Oh,
Collaborative.
perfect,
Yeah,
buddy. So we see each other there, and we can
I
drink
will.
heaps and heaps of beer. Yes.
I will. I'll try and get there just to see yourself and Leonie, Tom. That's what I'll
Yeah,
try
that
and
would be
do.
nice. That would be nice. Yeah. Yeah.
Yeah, but lots of research work, lots of practice, lots of training. The, your thesis, your PhD thesis, was it the origin of soft tissue filler adverse events? Was that the actual thesis title?
Yeah, it was, and so my professor, he was always Tom, not Tom again, with his big mouth and big
I've,
plans. But
I've got a
every
summary of it there, Tom.
yeah, it's nice, and it wasn't. And every time I did not disappoint him, and then I came up with a very bold title: "The Origin of Soft Tissue Filler Adverse Events,
Yeah,
Past, Future, and Present." And he went along with it. So
yeah,
I like the title a lot, but I was very surprised that he let me take it. But yeah, again, very bold statement, but I
yeah,
truly think that this is a fundament for future research, and it's
yeah,
also a fundament for, in the future, everybody in the world, if you're doing soft tissue filler treatments, I think you should dive into our research,
yeah,
and it could help you become a better doctor, and it could help you get less adverse events. And in the end, that's what everybody wants, for I got an adverse event myself 2 months ago, and that's normal. All of us is going to get adverse events. If you inject a lot, you could get an adverse event because you're doing, although it's minimal, but it's an invasive treatment. And I even had my 4th vascular adverse event half a year ago. So I've been doing this for at about 14 years now, and I've got my 4th vascular adverse event. And yes, it also happens to me. And yes, it's very normal that it happened to me. And yes, I hope you haven't undergone it, had it yet, Viv, but it will happen to you if you keep injecting.
It's not the fact that you get a problem, it's what you do about it that's more important, I think. But practitioners perhaps feel a little bit worried about it happening, but it's more a case of being trained to deal with it properly, identify the problem for a start, use the correct equipment, the tools, your learning, your skills, to find a solution to the problem quickly and effectively. That's what I think. That's how you should be trained as a healthcare practitioner. Identify the problem and deal with it. Problems happen to everybody. You can't control whether a problem is going to happen in future. And as your research shows, adverse events is a big area of work for anyone who deals with dermal filler injections. And cosmetic, non-surgical cosmetics is just increasing around the world. So it's important for practitioners, I think, to look at the work you're doing and to make use of it for their own benefit.
Yeah, not true that. Yeah, a few things. So if an adverse event happened, then you as a doctor are not capable of sleeping that well. So you have a very bad time as long as the problem is there. But of course, the patient is going through hell because she or he wanted to look better. The opposite happened. So what the hell the patient goes through and the hell you go through as a doctor, you both don't want it. So in some way, you're able to lower that chance. Of course, everybody wants to do that. So I think it's very important not to specifically, read my thesis, but take those things out, becoming a better doctor. Going back to vascular adverse events, and again, the recognizing part is very important. For instance, if somebody has a vascular adverse event, they go to the emergency room at the hospital, and many doctors are not able of recognizing a vascular adverse event. So that's also the reason why I'm training all kinds of doctors in the Netherlands and all around the world in recognizing. For recognizing is phase 1.
You'll find it interesting at CMAC in November because I think last year or the year before they did some research work at some of the hospitals in London. I think it may be in King's Cross. And they interviewed the doctors who work in the emergency room to find out how well they're trained, if at all, to detect vascular occlusion following dermal filler treatment of the face. And it was quite scary because very few of them knew what to do and knew how to recognize it. Only the doctors who did treatments themselves, aesthetic treatments, were really in any position to identify the problem.
But Viv, again, I'm a very naive and romantic person. So if you turn this around, the questions were asked. It was a point on the agenda.
Yes. That's true. It needs work, more and more questions to be asked to find out more information.
Yeah, and again, like every other medical specialty has been there for like decades or even hundreds of years. And aesthetic / cosmetic medicine, what you and I are doing, only has been there for like maybe 2-3 decades. So looking where we came from, the last couple of years went very well in getting awareness. So like, for instance, like 10 years ago, when we were speaking of complications of adverse events, it was somewhere at the back at IMCAS or AMCW, which is in Monaco. And now, step by step, we're getting that biggest stand, or we're getting the biggest room to talk about adverse events. So step by step.
It's really nice to talk to you, somebody who's really passionate about his work. And I thought really I'll go through your research, your thesis, looking at the origin of soft tissue filler adverse events. Part of that, one of the aims of that was to look at how your work could be used to diagnose and treat adverse events. I think that was one of the things. And you mentioned ultrasound in a lot of that work. So I'll pop this up here. Number 5 was methods of diagnosis and treatment of these adverse events. And you specifically mentioned ultrasound imaging as a very effective new way for most practitioners to be able to identify and treat these adverse events, whatever they may be. You've got basic adverse events, you've got more complex ones. But it was important that was important to me because I'm talking about ultrasound in particular and how ultrasound imaging in aesthetics can help not just the practitioner, help us go to sleep more easily on a night, but also make life for the patient far more comfortable following a problem, and also to minimize the risk of it happening in the first place. The whole issue of ultrasound for me is not just treating a problem, but to minimize it happening in the first place. And in your work, in your polyclinic work, do you think if practitioners had used ultrasound before treatment was carried out, do you think it may have reduced the frequency of these problems?
Yeah, a few taglines. So first, you can remember it, and he's quite nice. So ultrasound will be the stethoscope of cosmetic medicine in the future. So in decades from now, if we look back, we say, why the FUCK? Nobody thought of this before, but that's always with brilliant things like with Peter and Leonie, what they invented and came up with. It's so easy. It's so incredibly easy. So I even learned how to use ultrasound. So before you treat with anatomical knowledge, you can see the different layers. You can even see bigger vessels and arteries. And then you inject and you can check if you laid it in the proper layer or in the proper area where you wanted it to treat. But I see ultrasound for the general cosmetic injector as an add-on. So if you have been properly trained, you use the proper products, and you have common or very good facial anatomical knowledge, then the ultrasound could be an add-on to become an even better doctor and get lesser adverse events. But still, again, I also get adverse events. I even get vascular adverse events. So there are a lot of doctors, again, with very big shoes who say that ultrasound is BS, but even the guys, most of the time guys with the biggest shoes, they now even say it might come in handy and we might use it. So in time, it truly will be the stethoscope of cosmetic medicine. I truly think it will.
Great. It's part of your research work, part of the thesis, the origin of the soft tissue filler adverse events. You look at ultrasound and you look at the application of ultrasound in your work. I've put this up just so people can see. All of this information I'm putting up is in your research work, which is available for anyone to look at. You mention how it can be used for detecting anatomy, vascular mapping. You can prevent problems if you can look at an individual's anatomy more carefully before you touch them with a needle. You can look at previous fillers. You can see how that may have an effect on treatments you carry out. You also look at a problem once it's happened. What can you do about it? How do you detect it? How do you treat it? All these things I thought would be, I could help to show people how this is relevant to their practice by showing some examples of scans that a few of my colleagues have carried out. So what I'll do, Tom, if it's okay with you, I'll pop up a few scans and you can comment on them if you like. Some of them are Leonie's because only she can carry out some of these scans. I don't know anyone else in the world capable of doing it.
No, but those are some very important disclaimers, my friend. So first, again, another tagline. So I think that first we were blind and now we can see. So before ultrasound, we were blind and now we can see. Black and whitish, but yes. Then again, Leonie is the queen of ultrasound. So if she looks with ultrasound, sometimes even Peter and I look over her shoulder and we think, really, Leonie, are you seeing this? So it's very hard. So I would say for everybody who is thinking about going to use ultrasound, start with the basic layers and seeing on the one hand what's bone, what's muscle, where are the big arteries. So don't push yourself and don't think that if you use ultrasound that you won't have adverse events.
No. As you say, it's a tool to help you work more carefully. It's not a solution. It's not an answer. Yeah. As long as people understand it's there to improve their practice and make things easier. It's not going to solve a problem from happening in the first place, but it's there to help you should you need it. So what I've got, Tom, based on, again, your work, preventing adverse effects and improving efficacy, I've got a couple of scans here. The first one is an infraorbital scan carried out by Carolina Mara-Lewis. Infraorbital scan that she carried out just to look at blood flow, you know, around the foramen, just below the eye. So this is one of her ultrasound scans that she's carried out. I've carried out some CGI work on it. You'll see just in a second, but it's really to show anatomy. I've then used some CGI augmentation so you can see the whole work more easily. You can see the different tissue layers. You can see where the blood flow is. You can see the relevance of the tissue layers and how that may affect injecting in certain parts of that anatomy. So this is just one example, just to show how adverse events could be minimized and how to improve efficacy as well.
What is very important of this short movie that you showed is always also make sure that you use the Doppler to see where the arteries are. For sometimes, depending on how you hold the probe, you would think that you see something blackish, what could be an HA filler. But if you move the probe and you put on the duplex, you can see that it was an artery. So that is very important. So when you look at a specific area in the face, always make sure that you also have a look at the same area, but then with the Doppler. Yes.
Do you deal with many problems, periorbital, infraorbital issues at the clinic?
Infraorbital doesn't happen that much. It's a big buzz, and everybody would like to talk about it. And I think there are one or two persons in the world that ever really intraorbital injected something. But in general, periorbital is the area where the HA filler contracts the most water. So I see heaps and heaps of malar edema post HA filler in the tear trough. And that always makes me say in interviews like this is a very, very premium, high-level treatment, and you as a doctor should be very hesitant to do that treatment. And I know the best doctors in the world that even stopped doing HA filler in the tear trough. So that's one. And two, you as a patient should also really do your homework before you even let a doctor inject HA filler in the tear trough, because if it's injected in the wrong layer or in the wrong amount or with the wrong product, then you could get malar edema, because the lymph drainage system is hurt in such a way that it's harder for the lymph node fluid to go away. But the malar edema, even when I take away the HA filler with hyaluronidase, the malar edema sometimes stays there.
Right.
So something that is very easy is that in your anamnesis, before you do the treatment, you should always ask a patient if they also at first already have some malar edema, or that in Thailand or in a sauna if they swell up before, because if they do, you shouldn't even touch that area. So Tom, do you see a lot of adverse events from the perioral area? Yes, Viv, I do.
Good. Well, not good, but I mean good for telling me about that. Here's another scan. This is nasal scan carried out by Dr. Zainab Al-Mukhtar. Now, she's carried out longitudinal scan showing blood flow in certain layers of the nose. And again, I've carried out CGI augmentation on this just so you can see it more easily. It'll be 1 second. Blood flow, different layers of the nose. Again, ultrasound can help, I think, to improve safety with nasal injection. This is the CGI version. You can see the layers more easily using the CGI that I use. And it's really just to make it a little more easy to show what you're looking at. For a new person in particular, you probably think I don't need this, but I think even Leonie appreciates the fact that you can see things a lot more easily.
No, but my dear friend, I every time I do a nose treatment with fillers, I use ultrasound, and like the perioral area, nose treatments is again a premium, very high level. So if you have been doing HA filler treatments from some years now, don't even touch that area and don't do it. And again, I don't know if I mentioned it already, but if you are in doubt, this is my third very nice tagline, if you are in doubt, don't. If you are in doubt, don't. So if you are in doubt, or am I good enough? Do I have enough knowledge to do this treatment? Don't do the treatment. Because if you do the treatment and things go wrong, then you mentally and the patient, both mentally and physically, could be harmed for life. Because again, in the nose area, adverse events, and specifically vascular adverse events, could be very devastating.
Leonie's just mentioned she loves the work I do on her scans, Tom. I thought I'd mention that. Have you seen severe problems, complications, blindness coming to the clinic, or at the point of losing vision? Has that ever happened?
Yeah, in Holland we had one case, one eye, I think 7 years ago, but there was a big doctor's delay because of the shame of having such a case, and also the doctor was not able to contact us in time, so the patient went to the emergency room, and there they didn't also know what to do. So it's really sad.
In your research, you mention there's figures for how long it takes for you to see a patient with a complication, with an adverse event. And I'm amazed how quickly, generally, you manage to see these patients following transfer from another practitioner.
Yeah, but Holland is like the smallest, well-organized country in the world. And although a lot of people think I'm a big show-off and on the Dutch television all the time, people know us. So every doctor has Leonie, or either me or Leonie or one of our colleagues on speed dial. And
you do some great work, I've got to say. It's fantastic being able to talk to you.
Thank you.
This this next example is a guided filler injection carried out by Stella Desiatnikova. It took me longer to work out how to say her surname than it did to augment these images, Tom. So I'll show you this one. This is, oops, sorry, that's another one of Zainab's. I'll get rid of that for now. So this is a scan of a temple filler treatment carried out by Stella. And this is guided injection. Now, it's a bit tricky to see. There's a needle moving into the into one particular layer, and she's injecting dermal filler within a layer of tissue. They're quite
superficial.
Yeah. It's in a certain region in the temple area. I'll show you in the CGI. You'll see exactly what I'm talking about.
Yeah.
There we go. So you've got different layers of tissue. She's injecting the red area with, that's filler, and it's between the deep temporal and the superficial temporal region.
Yeah. I would say that in this ultrasound, one could say that this patient previously was already injected in this area.
Yeah. I think it may have been because there was, I think, some filler previously in there. She's just added further filler following this treatment. With filler treatments, again, do you see particular adverse events in relation to temple filler treatments, Tom?
Come again?
Adverse events. Do you see any particular adverse events related to temple filler treatment?
Yeah. There was a very interesting case in which a specific doctor was capable of giving a vascular adverse event to a specific two different patients, but in 2 months' time, and they both got hair loss also in that that area. Yeah, and again, you're mentioning all those specific treatments, which are. I did my first temple like 4 years ago. After I've been injecting 10 years.
Yeah.
So again, to everybody all around the world, be very hesitant in doing that premium high-level treatments. And start with the more superficial and more simple treatments, please.
Yeah. No, that's great. Next few scans. These both Leone scans. This is assessing and treating adverse events. So the first one is a delayed onset nodule above the jawline within the SOOF. So I'll just get this up. This is her original scan, and this is assessment of a nodule, as I say, above the jawline within SOOF. Now, I CGI'd it. I carried out some CGI work on it, so you can see the layers a little more easily. She found a nodule within the SOOF, and it was causing problems for the patient. It just brings out the importance of injecting in the right plane of tissue, I think. And
it is.
A lot of the adverse events you'll be seeing when you're scanning, I assume, a lot of these are injector-related problems that could have been minimized if it had been injected properly in the first place.
Yeah, that's true. I also recognize this being a Leonie ultrasound scan because of the tremor in her hand, because of her age.
She's not going to be happy with you tomorrow.
I don't care. It's very important that we smile a lot.
Yeah.
And seriously, but again, this is also you're going from talking about ultrasound to very big conclusions that we were capable of concluding after like 15-20 years of hard ultrasound work. So we recently came up, or most of the time Leonie did, came up with some hypotheses about why adverse events occur. And most of the time, adverse events occur because of doctors not knowing where they're injecting. And that has something to do with experience, the product that they choose, needle versus cannula. There are many reasons, but yes, it's true. we think that a lot of adverse events are there because of doctor-related injecting methods. Yeah.
Yeah. Great. Last one, Tom. This one
Again,
is again one of Leonie's, and it's
no, not her.
I'm sure you enjoy looking at her scans. This one is related to filler below the angular vein following a tear trough treatment.
Yeah.
So let me get this. So this is one of her scans, and I showed this last week actually, but I thought I'll show it again because it's such a nice scan. She detects filler under the angular vein, and she uses hyaluronidase to dissolve it, guided, which she's doing there.
Yeah,
and
it's amazing.
Yeah. She was talking about the fact that a lot of issues aren't Tyndall effect problems under the eye. It's to do with the vein being pushed upwards.
Yeah.
And you can see there, there it is. She's dissolving the filler and the vein dropping back down to its normal level.
Yeah. A few things which are very important. So she's using a lot of gel. You could see in the that's very important. That use a very large amount of gel, so that's easier, and then you don't compress the arteries and the veins.
Yeah.
And something that is very important, that most of the time, Leonie and Peter and I, we are cheating because we are using very big, high frequency ultrasound machines which give amazing movies and pictures that the common doctor who's using like Philips Lumify, which has like 10 megahertz something, then it's you cannot compare it.
It's just that you and Leonie and Peter make this look so easy. You know, the work you do. It takes a lot of skill, knowledge, and experience to do what you do. But you make it look so easy, and people have to remember it isn't as easy as you make out.
No, thank you very much, my friend. But we came also a long way. So being here is just putting a lot of effort in it, and if you're just starting to use ultrasound, then in every new patient that you see, take your time and just look with ultrasound. And if you then things that are very easy but so beautiful, if you see it happen, that you look first with ultrasound, then you inject, and then you look again with ultrasound, and then you can see, yes, it was on the periost.
It's just that, do you think certain types of research in the future could potentially look at efficacy? How effective has a treatment been using ultrasound guidance and follow-on assessment using ultrasound to check position of filler? Compare that with treatment that didn't involve ultrasound at all, no pre-vascular mapping, no guided injection, no post-treatment scanning. Do you think research comparing one to the other would be useful in future?
Yeah, for sure. And we are in a lucky position that we have a new PhD student, cosmetic doctor, who also has like 15 years of experience. So she's very much knows what she's doing, and she is diving in these specific questions. So yes.
Amazing. Finally, to wrap up, we've been talking for about 50 minutes, Tom, and it doesn't seem that long.
No way.
Honestly, 50 odd minutes we've been talking. I could talk to you all night. I honestly could.
I hear that a lot. But not only in the pub, eh? Viv?
Yeah, we'll talk all night in the pub in November, when I see you in November, hopefully. But to finalise, to bring this discussion to an end, we've talked about the past, the present. What about the future? In terms of ultrasound scanning in aesthetics, what would you like to see, and what in an ideal world for you would be the relation to ultrasound and aesthetic work?
I think that ultrasound, how do I put it mildly? So if everybody is going to use ultrasound pre and after, that's a way of using ultrasound. But to make cosmetic medicine more safe, I would look at general training of doctors, rules and regulations, but far and foremost, two important things in the Netherlands and most European countries, they're at about 150 soft tissue filler brands. And I would like to see, and also in the next few months, an article of ours will be published in which I elaborate some more about those 150 brands, that since soft tissue fillers are now like medical devices, we should more head towards like medicine, like botulinum toxin is. There are like 4 or 5 brands of botulinum toxin, which gives more like rules and regulations. So that's one thing. And the second thing is, we and another team of mine, we're putting a lot of time in creating awareness in society. So young adults, children, women mostly, between 18 and 25, but maybe even younger, at all kinds of, I don't know how it's called, preliminary schools, blah, blah. Yeah, go there. Viv, we should go there and explain them about Botox and fillers. And it's not a game. It's not a sandwich that you can get just around the corner. And both doctors and patients sometimes treat it like it's getting a sandwich just around the corner. And it isn't. It's a medical treatment. And it's minimal, but it's invasive. So those are my 2 things for the future.
Great. No, it's been fantastic talking to you, Tom. It's really been enjoyable. Is there anything you'd like to say that we haven't talked about already? Is there anything you'd like to say to anyone who might be thinking about ultrasound, or who might be looking at your work and thinking, well, what relevance is that to me in my injecting? You've talked for an hour, but I'm going to still carry on injecting without ultrasound. I'm still going to get complications. I can't control them. That's what a lot of people might think. What have you got to say to those people?
Yeah, that's a way of doing of being a doctor. But I think it's very important that, since cosmetic medicine has not been there for such a long period of time, that you also have to go and look at new developments in your line of field. So maybe ultrasound is not your thing, then dive into our DNA test that we developed to be able to predict if you're going to have an adverse event of a complication of an adverse event of a soft tissue filler treatment. Or dive into our article about bacteria when you inject. So clean better before you treat. It's so unbelievably easy, but we also write that in our article. I know that bacteria are injected during the initial treatment and are still there surrounding the filler. So yeah, there are so many things you can do to become a better doctor, get less adverse events, and sleep better for you and for your patient. But Viv, the problem is, you gave me so much time. Already said everything I wanted to say.
You could talk about anything. It'll be fascinating to listen to, Tom, to be honest with you. That's what I think.
No, yeah, in an hour, I'm going to talk with the Arsenal CEO about football. So, yeah.
Really?
I can talk about every subject.
It was when I was talking to Leonie about your interest, and she mentioned football. She actually said to me, Viv, it's Ajax. And that's why I initially produced an Ajax team shirts.
One of my problems is that I live in Amsterdam and I support a club from the south of the Netherlands, but my 2 boys, they support Ajax. So we had a great laugh when I showed them that picture. And laughing, again, is very important. So it's also very good that we wrap up this interview, this live session, smiling, my friend.
It's nice to be able to smile and speak to you about things like this. I'll say a really big thank you, Tom, for joining me and speaking and giving all your information and advice so clearly and so effectively and so nicely. It's really nice chatting with you. Next week, I've got Rosa Segrist, who had a fantastic conversation with you a couple of weeks ago. That was really nice to watch. And she'll be joining me next week, again, talking about ultrasound from her point of view as a radiologist.
Cool.
So that's going to be interesting.
Cool.
And Sunny, my co-host Sunny, unfortunately is away on holiday next week, so he'll be back in a couple of weeks. But I hope to see you and Leonie in November in London at CMAC. I hope to do that. We'll have a drink. I'll buy you a drink with Leonie as well.
Perfect, perfect. Thank you so much for your time, Viv. Have a great time with Rosa next week, because she is amazing and she has a lot of knowledge about ultrasound.
Great. Thanks very much, Tom. I've got to say thanks to everyone for watching. There's been lots of messages shooting up and I haven't even bothered looking at them, to be honest. So I'm just gonna say thanks to everyone for watching, and this will be up on Instagram to watch later on if anybody wants to. Thanks again, Tom, and I will hopefully catch up with you at some point, hopefully by November anyway. I hope to see you in London in November.
We will surely be seeing each other, and see you next time, Viv.
Thanks very much, Tom.
Bye.
See you. Bye.